Every 66 seconds, another older adult in America is diagnosed with dementia. Before this video is over, several more families will hear those heartbreaking words. Most of them will immediately assume it happened because of age. But according to the source, that is not always the complete story. Sometimes the problem is sitting quietly inside a medicine cabinet. A pill taken every single day, trusted for years because it came from a pharmacy or was recommended by a doctor, may also be affecting the brain in ways many people never imagine. I am Dr. Sofia, and after years of caring for older adults, I have watched this situation unfold again and again. Someone who spent an entire lifetime with a sharp mind slowly begins forgetting names, missing appointments, repeating the same questions, or losing confidence while driving familiar roads. Family members often say, "This is just what happens when you get older." According to the source, newer research suggests that certain medications deserve much closer attention when unexplained memory problems begin to appear. That does not mean these medicines are bad or that everyone should stop taking them. Many of them save lives every day. But it does mean every older adult should understand both the benefits and the potential cognitive risks before continuing them for years without review. Today we are counting down 9 categories of medications discussed in the source, beginning with those that are often overlooked and ending with the one the source considers the greatest hidden threat to memory. The goal is not fear. The goal is awareness, because recognizing a medication-related problem early may allow you and your healthcare provider to make safer decisions before more damage occurs. Let's begin with number 9. Do not let its position on the list fool you, because it is one of the most common medications found inside American homes. Number 9 is diphenhydramine, better known by the brand name Benadryl. People reach for it to relieve allergies, calm a cold, or simply help themselves fall asleep. Because it sits on the shelf without a prescription, many assume it must be harmless. According to the source, the situation inside the brain is very different. Benadryl belongs to a group of medicines known as anticholinergic drugs. While the name sounds complicated, the basic idea is simple. These medications block a brain chemical called acetylcholine. According to the source, acetylcholine plays a major role in forming new memories, maintaining attention, and helping different parts of the brain communicate effectively. As people grow older, natural acetylcholine levels gradually decline. That means blocking what remains can have a much greater impact on a 70-year-old brain than on someone decades younger. The source explains that one of the areas most affected is the hippocampus, the region responsible for creating and organizing new memories before they are stored. When this process is interrupted repeatedly over months or years, memory problems may slowly become noticeable without people ever suspecting the medication they take every evening. According to the source, research published in 2023 followed older adults who regularly used anticholinergic medications and reported a substantially higher risk of developing dementia compared with those who avoided them. The source also emphasizes that many patients never connected their increasing brain fog with the small pink pill beside their bed because it had become part of their nightly routine. One practical suggestion presented in the source is to carefully read the labels on sleep aids, allergy medications, and products marked PM or nighttime, since many contain diphenhydramine under different brand names. The source also notes that newer antihistamines, such as loratadine, commonly sold as Claritin, are discussed as alternatives that are less likely to enter the brain the same way. Most importantly, the source repeatedly reminds viewers never to stop a medication without speaking to their healthcare provider first. The purpose is not to throw medicines away. The purpose is to ask better questions and make informed decisions. Number 8 takes us from the bedroom to the stomach. According to the source, proton pump inhibitors, including medications such as omeprazole and esomeprazole, are prescribed every day for heartburn, acid reflux, and stomach ulcers. For many people, they work extremely well, which is exactly why they remain on them for years. However, the source explains that reducing stomach acid for long periods may also reduce the body's ability to absorb important nutrients, particularly vitamin B12. Since vitamin B12 plays an essential role in maintaining healthy nerves and brain function, low levels may gradually contribute to confusion, slower thinking, and memory problems that can easily be mistaken for normal aging. The source also discusses magnesium and calcium as additional nutrients affected by long-term acid suppression, and cites research suggesting a possible association between prolonged PPI use and cognitive decline. According to the source, anyone taking these medications every day for an extended period should have a conversation with their healthcare provider about whether the current dose is still necessary, or whether safer long-term strategies may be appropriate. And the next medication on this countdown may surprise you even more because it is prescribed for a problem millions of older adults struggle with, but very few ever associate with memory loss. Now we continue with number 7, a medication prescribed for a problem that millions of older adults deal with, but very few enjoy talking about. According to the source, number 7 is oxybutynin, commonly sold under the brand name Ditropan. It is prescribed to help control an overactive bladder by reducing the sudden urge to urinate. For many people, it restores confidence, makes travel easier, and allows them to sleep through the night without constant interruptions. Those benefits are real. But according to the source, this medication works by blocking the very same brain chemical we discussed earlier, acetylcholine. That is what makes it especially important for older adults. The source explains that oxybutynin crosses into the brain more easily than many other bladder medications, allowing it to affect areas responsible for learning and memory. Over months and years, people may begin forgetting appointments, misplacing everyday items, repeating questions, or losing track of conversations. Because these changes develop gradually, families often blame normal aging instead of considering whether a medication could be contributing. According to the source, research published in the British Medical Journal reported that older adults taking strong anticholinergic medications like oxybutynin for extended periods showed a significantly higher risk of dementia compared with those who did not. One of the most important messages in the source is that no one should feel forced to choose between bladder control and brain health. It discusses newer medications such as mirabegron, which work through a different pathway and are considered less likely to interfere with acetylcholine. Rather than stopping treatment, the recommendation is to discuss available options with your healthcare provider and determine which medication best matches your personal health situation. Number 6 may surprise even more people because it belongs to one of the most widely prescribed classes of medication in the world. According to the source, statins, including medications such as simvastatin and atorvastatin, are used to lower cholesterol and reduce the risk of heart attacks and strokes. The source makes something very clear. These medications save lives and should never be discontinued without medical guidance. However, it also explains that cholesterol is not simply something the body tries to eliminate. The brain itself contains large amounts of cholesterol because nerve cells depend on it to build and maintain their protective coverings. According to the source, some statins are able to cross into brain tissue more easily than others. Research discussed in the source suggests that certain older adults taking these medications for several years reported increasing forgetfulness, difficulty concentrating, or episodes of mental fog. The source further explains that not all statins behave the same way. Medications such as pravastatin and rosuvastatin are described as less likely to enter brain tissue than others. Therefore, anyone noticing cognitive changes while taking a statin should speak with their physician about whether another option or a different dosage may be appropriate. Once again, the source emphasizes that the answer is not to stop medication independently, but to have an informed conversation supported by medical advice. Halfway through the countdown, we arrive at number 5, the benzodiazepines. According to the source, this group includes medications such as lorazepam, diazepam, and alprazolam, commonly prescribed for anxiety, panic attacks, and insomnia. At first, these medications often feel life-changing. Anxiety quiets down, racing thoughts become manageable, and sleep finally returns. But according to the source, the brain gradually adapts to their presence. Instead of simply calming anxiety, long-term use may begin slowing overall brain activity. Research described in the source found that older adults using benzodiazepines for several months or longer showed a substantially higher risk of Alzheimer's disease than those who avoided prolonged use. The source explains that longer-acting medications appear especially concerning because they remain inside the body longer and accumulate over time. Many patients describe feeling emotionally flat, mentally slower, or as though they are moving through a constant fog. One of the most important warnings presented in the source concerns stopping these medications abruptly. Sudden withdrawal may be dangerous and can lead to severe anxiety, insomnia, or other serious complications. For that reason, the source strongly recommends working with a physician to gradually reduce the medication if a change is appropriate. It also discusses alternatives, including buspirone for anxiety and cognitive behavioral therapy designed specifically for insomnia, approaches that may provide relief without creating the same degree of cognitive burden. And according to the source, the next medication on the list may be even more concerning, because many people do not even realize they are taking one of the strongest anticholinergic drugs still commonly prescribed today. Now we reach the top 4 medications in the countdown, beginning with one that many older adults take for reasons completely unrelated to depression. According to the source, number 4 is amitriptyline, commonly sold under the brand name Elavil. Although originally developed as an antidepressant, it is still widely prescribed today for nerve pain, migraines, and sleep problems. That broad range of uses is exactly why so many people never question it. The source explains that amitriptyline is one of the strongest anticholinergic medications still commonly used, meaning it blocks acetylcholine far more aggressively than many people realize. Since acetylcholine is essential for communication between brain cells, long-term use may gradually interfere with learning, concentration, and the formation of new memories. Research discussed in the source followed thousands of older adults over many years and found that those with the greatest cumulative exposure to strong anticholinergic medications showed a substantially higher risk of developing dementia. According to the source, the most concerning part is that many patients believed the gradual decline in memory was simply part of growing older, never realizing their medication might have been contributing. The source discusses several alternatives depending on the condition being treated, including newer medications for nerve pain and antidepressants considered less likely to produce the same anticholinergic burden. As with every medication in today's discussion, the recommendation is never to stop treatment independently, but to review available options with a healthcare professional. Number 3 is the medication the source specifically warned viewers to watch carefully. According to the source, paroxetine, sold under the brand name Paxil, belongs to the SSRI family of antidepressants. Most SSRIs are considered safer for older adults than older antidepressants, but the source explains that paroxetine is different because it also possesses significant anticholinergic activity. That characteristic places it in a unique position compared with medications such as sertraline and escitalopram. Research summarized in the source reported that older adults taking paroxetine demonstrated measurable declines in short-term memory, attention, and word recall within the first year of treatment, more often than patients using other SSRIs. The source also notes that the American Geriatric Society includes paroxetine on the Beers criteria, a list identifying medications that may present greater risks for older adults. According to the source, anyone currently taking paroxetine should discuss with their physician whether another SSRI may provide similar benefits with a lower risk of affecting memory. Supporting overall nutritional health, including adequate B vitamins, is also mentioned as part of a comprehensive conversation about healthy aging, but the primary recommendation remains careful medication review rather than self-treatment. Number 2 introduces a class of medications that often worries families because they are frequently prescribed under difficult circumstances. According to the source, antipsychotic medications such as quetiapine, risperidone, and olanzapine were originally developed to treat serious psychiatric illnesses. Today, however, they are sometimes prescribed to older adults experiencing agitation, sleep problems, or behavioral symptoms associated with dementia. The source explains that these medications reduce dopamine activity within the brain. While this may help control severe behavioral symptoms, it can also slow thinking, reduce alertness, and contribute to worsening cognitive decline in some individuals. Research discussed in the source found that older adults receiving antipsychotic medications for behavioral symptoms experienced a significantly greater risk of worsening cognition, along with increased risks of stroke, falls, and excessive sedation. According to the source, one of the most important questions families can ask is why the medication was started, whether it remains necessary, and whether non-medication approaches might help address the underlying problem. The source describes structured daily routines, reducing unnecessary noise and overstimulation, treating pain, and improving sleep habits as strategies that may reduce behavioral symptoms without immediately relying on powerful medications whenever appropriate. Finally, we arrive at number 1, and according to the source, it is not a single medication at all. It is something known as anticholinergic polypharmacy, the combined effect of taking several medications that all reduce acetylcholine at the same time. The source describes a common situation in which one person takes Benadryl for sleep, oxybutynin for bladder symptoms, and amitriptyline for nerve pain. Individually, each medication may produce only a modest effect. Together, however, their combined anticholinergic burden becomes much greater than most people or even their families realize. Research highlighted in the source followed hundreds of thousands of older adults and found that those carrying the highest anticholinergic burden experienced more than double the risk of dementia over time, compared with individuals carrying the lowest burden. According to the source, the encouraging news is that medication-related cognitive decline may improve when recognized early. That is why the final recommendation is not fear, but action. Schedule a complete medication review with your physician or pharmacist. Bring every prescription, every over-the-counter medication, every vitamin, and every supplement. Ask whether any medications overlap, whether safer alternatives exist, and whether your total anticholinergic burden can be reduced safely. According to the source, protecting memory is not always about finding one new treatment. Sometimes it begins by taking a careful second look at the medications already sitting inside your medicine cabinet. That simple conversation may become one of the most important steps you ever take to help protect your brain as you grow older.